First aid training. Considerations. Be safe. You must secure the scene before proceeding with any first aid treatment. If it is not safe, call 911 and stay with the injured. Be prepared. Most injuries will be minor, but you should be prepared that circumstances could change and become serious. Be ready. While administering first aid, cardiac arrest is possible. You should always be ready to perform CPR if the victim becomes unresponsive or stops breathing. Medical alert. Always look for medical identification jewelry. You will typically find them located around a person's wrist, neck, or ankle. The jewelry will list medical information on the back for the person you are helping. It will indicate allergies, autism, epilepsy, diabetes, asthma, seizures, DNR. Do not resuscitate. If it says DNR, you do not perform resuscitation or CPR. Call 911 and stay with the person. Bloodborne pathogens. Take universal precaution when providing CPR and first aid, and treat all blood and other body fluids as if they are infected with disease. Remember, if it is wet and not yours, don't touch it. Use the following personal protective equipment, PPE, if available: gloves, masks, eye protection, gowns, face shields. First aid assessment. Scene safety. Make sure the scene is safe before giving aid to the victim. If it is not safe, call 911 and stay with the victim until help arrives. Call 911. If the person is unresponsive, shows signs of heart attack or stroke, severe bleeding or burns, seizures, head, neck, and spinal injuries, or if you feel out of your depth to provide care. Get consent. You must get consent before proceeding with aid. If the person is unresponsive, you have implied consent. Help. If you are given permission, start helping the victim by scanning for medical alert jewelry and any obvious injuries. Start treatment of major injuries to the victim first. Pediatric scene safety. When assessing scene safety, determine if there are any child victims. If a child is present and they do not have a suspected head, neck, or spinal injury, move the child farther from the scene and then take care of their injury or injuries while keeping them distracted. Keeping them farther away and distracted can help prevent shock, traumatizing visual images, and PTSD. Especially move and distract them if the following is or has occurred: CPR is being performed, deceased bodies, major bleeding, deformities, major burn. Pediatric injury assessment. Remain calm and friendly. Tell them your name. Speak slowly and ask questions about incident, and incorporate child's age, favorite toy, cartoon, food. Assess injuries from toe to head. Bleeding. Signs. Broken skin. Blood oozing or draining out of wound. Pain in the area. Lightheaded or dizzy. Bleeding. Treatment. After a severe injury, a person can bleed to death in as little as 3 minutes. This means when accidental bleeding occurs, stopping the bleed in those first minutes is critical, and most times you can't wait for first responders to arrive. Direct pressure. Direct pressure can be applied anywhere on the body. If you are unsure about how serious bleeding is, start by applying direct pressure. Using a clean pad, apply firm and constant pressure directly on the point of bleeding using 2 hands. Packing a wound. For a more serious wound, it may be more difficult to control bleeding. You may need to pack a dressing tightly into the wound to maintain pressure to stop the bleeding. This can be done using your fingertips and directing pressure toward the bleeding vessel. Bleeding. Treatment. Tourniquets. Tourniquet is the first-line therapy for life-threatening extremity bleeding. Apply a tourniquet immediately. Do not attempt direct pressure if blood is spurting out of the open wound. Clothes are heavily soaked with blood or large pool of blood. Amputation of arm or leg. In a situation 3 minutes of direct pressure is not working, utilize the tourniquet. It should be placed 2 to 3 inches above injury. Once a tourniquet has been placed on an arm or leg, it should never be loosened or adjusted. Internal bleeding. Signs: car crash, motorbike crash, or bicycle crash. Fallen. Sports injuries. Being hit by another person or object. Injury to the torso. Pain in the chest or abdomen. Blood coming from the mouth. Shock symptoms. Treatment: call 911. Have the patient stay still and lie down if possible. Treat for shock. Impaled object. Signs: object is stuck in a person's body or in their wound. Knife, pencil, stick, etc. Treatment: make sure the scene is safe. Call 911 or seek medical care. Do not remove the impaled object. Control bleeding around the object. Stabilize the object so it cannot move in and out or back and forth. Signs: any part of a hand, foot, arm, or leg is removed from the body. Treatment: call 911. Make sure the scene is safe. Control the bleeding. A tourniquet may be necessary. Rinse the amputated body part. Place the limb in a sealed bag. Place the sealed bag over ice. Write the time, date, and patient's name to avoid misplacing the body part. Treat for shock. Shock. Signs: lots of blood loss, heart attacks, dehydration, severe allergic reactions, infection, broken bones, and car crashes will cause a person to go into shock. Weakness, lightheaded or dizzy, feeling nauseous, pale or grayish skin, feeling cold and clammy, confused, disoriented, or agitated, feeling thirsty. Shock. Treatment: call 911. Control any bleeding. Have the person lie flat on their back. Elevate the feet if possible. Keep them warm and cover them with an emergency blanket if available. Keep them calm and ensure they stay responsive. Head injuries. Signs: non-responsive, nausea and vomiting, headaches, confusion, dizziness, double vision or blurry vision, loss of memory. Treatment: call 911. Limit moving the patient and tell them to not move. Wait for advanced help to show up. Limit daily activities until fully healed. Neck and spine injuries. Signs: car crash, motorbike crash, or bicycle crash. Fall. No feeling, tingling, or is weak in the extremities. Pain or tenderness in the neck or back. Appears disoriented or not fully alert. Treatment: have the person remain as still as possible. Do not move them or twist or turn the person's body, head, neck, or back unless absolutely necessary. Wait for someone with more advanced training to arrive and take over. Broken bones. Signs: severe pain in the limb. Severe pain whenever the limb is moved. Deformity of the bone. Numbness or tingling below the break. Treatment: call 911 or seek medical care. Stop any bleeding, splint, sling, or immobilize the broken bone if possible. Keep the broken bone from moving. Cover the injured body part with a towel or blanket. Place ice packs on the injured area for 10 minutes at a time. Treat for shock. Burns. Signs: first degree, redness and swelling skin. Second degree, partial thickness, redness, swelling, and blisters of skin. Third degree, full thickness, white or blackened charred skin. Treatment: call 911 for all third-degree burns. Make sure the scene is safe. Do not get burned yourself. Remove any jewelry or tight-fitting clothing that is not stuck to the skin. Cool the burn with cool running water. Do not use ice or ice water. Cover the burns with sterile dressing if needed. Change them daily. Do not apply lotions or creams until the burn is fully cooled down. Pediatric burns. Caution: When cooling down a burn on a child, be cautious not to cool their core temperature down too much and give them hypothermia. Due to their smaller body size, they are at a greater risk to develop hypothermia in cooler temperatures and treatment with burns. Extra layers of clothing and jackets will help keep them warm in cooler temperatures and any areas that are not affected by the burns. Electrical burns. Signs. Burns where the electricity has entered and left the body. Burns on the outside of the body, and they can burn the inside of the body, injuring the organs. Initially, there is no way to tell the severity. An electrical injury can cause a person to stop breathing or go into cardiac arrest. Treatment. Call 911 or seek medical care. Make sure the scene is safe. Don't get yourself electrocuted. Move any electrical cords out of the way with a stick. Check to see if the person is breathing. Everyone with an electrical injury should be seen by a healthcare provider. Eye injuries. Signs. Pain in the eye, trouble seeing or double vision, swelling or bruising in the eye. Treatment. If material gets into the patient's eye, rinse with copious amounts of running water and blink continually. Cover both of the patient's eyes to limit movement of the injured eye. Seek medical care if needed. Tooth injuries. Signs. A tooth or portion of a tooth is broken off or gets knocked out. Treatment. Have the patient spit out any teeth or pieces of teeth. If the permanent tooth completely falls out, place it in cow's milk or patient's saliva. Do not use water. Do not hold the tooth by the root, only by the crown. Seek medical attention immediately. Diabetic emergency. Signs. Altered mental status and confusion. Irritability. Sweating. Shaking, trembling, or loss of coordination. Dizziness. Treatment. Quickly give the person oral glucose from a first aid kit. If not available, give granulated sugar mixed with water. Monitor patient. If symptoms are not resolved within 10 minutes, call 911 and try more glucose. Call 911 if the patient ever loses consciousness. Asthma. Signs. Difficulty breathing, wheezing, chest tightness, rapid heart rate. Treatment. Assist them with their inhaler. Keep them calm and tell them to take deep breaths and slow their breathing. Call 911 if inhaler does not work or it is not available. Seizures. Signs. Loss of muscle control, muscle contractions or spasms, not responding or loss of consciousness, fainting or extreme fatigue. Some patients experience an aura or a strange feeling before the seizure. Treatment. Call 911 if there is no history of seizures. Keep the patient safe and move objects or place padding against surfaces to help prevent injuries to the patient while they are having the seizure. Try not to touch the patient and never hold or restrict movements, and do not place anything in their mouth. Some seizures are managed by medication. Only touch the patient if they begin to vomit. Roll the patient onto their side and let the seizure finish with them rolled on their side. This will help with breathing and help prevent aspiration. If the seizure lasts longer than 5 minutes, always call 911. Allergic reactions. Signs. Mild symptoms. Lightheaded and dizzy. Stuffy nose, sneezing, or itchy eyes. Itchy skin. Swelling of skin, rashes, or hives. Severe symptoms. Difficulty breathing or rapid, short, wheezing breaths. Swelling of the tongue and face. Nausea or vomiting. Going into shock. Allergic reactions. Treatment. Call 911 for severe symptoms. Administer an EpiPen if possible for severe symptoms. Give a normal dose of an antihistamine for mild symptoms. Treat for shock. Only use the EpiPen if the patient is having severe symptoms of allergic reaction. Epinephrine pen. Call 911. Remove the safety cap on one end of EpiPen. Push the orange tip into the outer thigh, halfway between the knee and hip until it clicks. Hold in place for 10 seconds, and then remove the EpiPen, pulling straight back. Have the patient rub the area for 30 seconds. Use a second EpiPen if, The first EpiPen does not take effect in 60 seconds, or if EMS help has not arrived and the severe symptoms return. Heart attack. Signs: tightness, pressure, or pain in chest or back. Discomfort or pain in the neck, jaw, arm, or both arms. Shortness of breath. Lightheaded and dizzy. Sweating. Nausea. Indigestion or heartburn sensation. Treatment: call 911 and get an AED. Have them chew 1 adult aspirin or 3 baby aspirin. Keep them calm. Put them in a position of comfort. Treat for shock. Stroke. Face. Ask the person to smile. Is one side of the face drooping? Arms. Ask the person to raise their arms. Is one arm weak? Speech. Ask the person to speak. Is their speech slurred? Time. Call 911 right away at the first sign of stroke. Treatment: call 911 and get an AED. No aspirin. Keep them calm and comfortable. If given 3 hours of the start of symptoms, a clot-busting drug can reduce long-term disability for the most common type of stroke, so it is vital that the patient seeks medical attention. Naloxone/Narcan. Naloxone/Narcan is a drug that reverses the effects of opioids, such as morphine, hydrocodone, and heroin. Family members, caregivers, and first responders may carry naloxone to use in the case of an opioid overdose. It is safe and effective. Naloxone is available to purchase at most local drugstores. When and how to use it. If a person becomes unresponsive from an opioid overdose or you suspect an opioid overdose, call 911, get an AED and naloxone. Check for breathing. If not breathing, give the naloxone and attach the AED and begin CPR. 2 common forms of naloxone will be available: intranasal spray or autoinjector. Give the naloxone by spraying it into the nose, nasal spray, or by injecting it into a muscle with the autoinjector. If the person becomes responsive and/or starts breathing again, stop CPR and wait for advanced help to arrive. If the person continues to be unresponsive and not breathing, continue with the AED and CPR until advanced help arrives. Heat exhaustion and heat stroke. Signs: nausea and vomiting, high temperature, dry and hot red skin, confusion and dizzy, rapid, fast pulse. Treatment: call 911. Remove the person from the heat. Remove excess clothing. Limit exertion. Cool the person down to avoid organ failure or death, with water immersion to bring temperature down below 102 degrees. If water immersion is not available, apply ice packs, cold showers, ice sheets and towels, cooling vests or jackets, and fans. Hypothermia. Signs: intense shivering, but as hypothermia gets worse, they will stop shivering. Loss of coordination and slow moving. Mental confusion. Slurred speech. Lethargy. Cold and blue skin. Weak pulse. Treatment: call 911 or seek medical help immediately. Remove the person from the cold. Warm the person up slowly. Remove all wet and cold clothing. Cover them with warm, dry towels or blankets. Give them slightly warm fluids to drink. Never use hot fluids, and don't give them alcohol. Place in a heated room or buy a heater if available. Treat for frostbite. Frostbite. Signs: skin and body parts that have been exposed to cold temperatures for long periods of time. As it worsens, skin goes from red to white to bluish to grayish yellow or black. When pushing on the skin does not move. Cold skin. Numbness. Waxy skin. Frostbite. Treatment: seek medical attention. Remove jewelry. Soak the patient's frostbitten parts in room temperature or slightly warm water. Never use hot water. If they cannot be soaked, cover frostbitten parts with a warm, wet washcloth or towels. Do not rub or use friction to warm a frostbitten part up. Seek medical attention immediately. Snake bites. Signs: visible bite marks, bleeding, pain increases over time, redness and swelling around the bite, difficulty breathing, nausea, vomiting, and sweating, loss of consciousness. Treatment. Make sure the scene is safe. Do not get bitten yourself. Call 911. If you did not see the snake, assume it is venomous. Keep the bite below the heart and tell them to stay still. Immobilize the bitten limb if possible and tell the victim to stay still and remain calm. Remove tight-fitting clothing or jewelry. Wash the bite with soap and lots of water. Do not suck out the venom or cut and bleed out the wound from the snake bite. Spider bites. Signs. Non-poisonous spiders. Mild pain, itchy skin, swelling and redness at the bite. Blister or blisters. Poisonous spiders. Severe pain at the site of the bite. Muscle cramps. Nausea or vomiting. Fever. Joint pain or stiffness. Difficulty breathing. Headache. Seizure. Loss of consciousness. Spider bites. Treatment. Make sure the scene is safe. Call 911 or seek medical care. If you did not see the spider, assume it is venomous. Clean the bite with soap and lots of water. Place an ice pack on the bite. Apply antibiotic ointment. If the bite becomes infected or becomes an open wound, seek medical attention. Bee stings. Signs. Pain, itchy skin, swelling and redness at the sting. Severe allergic reaction, possible anaphylactic shock. Treatment. Make sure the scene is safe. Do not get stung yourself. Call 911 if anaphylactic shock is suspected and use their EpiPen. Remove the stinger with a scraping motion. Do not use tweezers. Using tweezers may squeeze more bee sting venom into the person. Wash the area with soap and lots of water. Place an ice pack on the sting site. Child abuse. Child care providers are required to report abuse, even if it's just suspected. Signs? Bruising, welts, or burns that cannot sufficiently be explained. Clusters of bruises, welts, or burns. Injuries on children where children don't usually get injured. Torso, back, neck, buttocks, or thighs. Withdrawn, fearful, or extreme behavior. Documentation. Always fill out an incident report. Fill out soon after incident so the details will be fresh. Be specific with factual detail. Be objective and give only the facts, not your opinion. Give a copy to the child's parent and keep a copy of file for records. If the child does disclose that they are being abused, contact Child Protective Services in your county. Poisoning. Signs. Look for bottles or containers, pills, plants, insects, bites, smells, etc. Very large or very small pupils. Rapid or very slow breathing. Stomach pain, nausea, vomiting, or diarrhea. Drooling or very dry mouth. Sleepiness or hyperactivity. Confusion or slurred speech. Rapid or very slow heartbeat. Treatment. Call 911. Call Poison Control Center, 800-222-1222. Try to get the container or any information of what they might have gotten into. Do not induce vomiting unless directed by Poison Control. Poisoning prevention. Ask yourself, is it a pretty poison? Does it look like something good to eat or drink to a child? Does it glitter or bright colored? Have pills that look like candy? Bottles and all kinds of containers can attract a child. Does it contain alcohol or gasoline? Is it an insecticide or pesticide? Is it a cleaning agent? If yes, store it out of sight and keep it locked up. Also, lock up household cleaners, laundry pods, and medicines. Do not call medicine candy, and always use child safety caps.